So we don't know the answer.
Okay.
Okay, so with that, we will see once they present all the data and have it out there in the published literature. What was released was about the levels of Huntington. And so we don't know if that translates to a change in the disease process. We hope that it does. If there's accumulation of this bad protein and you can take that bad protein and basically suck it out and have the body get rid of it, does that mean that we're changing the course of the disease? Hopefully, but we don't know the answer. And in 13 weeks, we don't know if we're changing the disease or not in 13 weeks. So I think that there are many questions related to this. It's exciting. It's really promising that we can see that the abnormal protein is lower based on our intervention. But what does it actually mean, and what are we going to see in terms of the disease process and symptoms even? I think that's what the next studies are going to show us. Because if we just lower mutant Huntington, but we don't do anything to the prevention of the disease or symptoms, then it's probably not worth pursuing. But if we're saving the rest of the brain and people don't progress, that's absolutely worth considering and doing it earlier and earlier in the course of the disease.
So, I mean, are they done? They can't do anything else with the data to do
they're doing
I
a
mean,
lot with the data,
but
I'm
I mean,
sure.
just on that, the amount of data they have for that particular trial, are they still looking at it to see if they actually did stop the disease, or does that involve another trial?
It involves another trial.
Okay.
Because you can't determine if you've stopped the disease in 13 weeks.
Okay. I didn't know if it was just, it's gonna take us more months of looking at the data to find out if we did, or they just
So
don't.
it's going to mean having people exposed to this drug for a year and a half, 2 years, maybe longer to see what happens.
Okay.
So should we sign up and go to the UK?
We don't have to go that far. There's Vancouver too. But if you'd rather go to the University of College London, Ed Wild's a fun guy to go visit.
Do you have any sense, based on the years and the different trials and the progress that's been made, where we are? I mean, I'm not asking for a prediction, but do you think based on what you've
I
seen?
ask because I think about this every day.
Yeah.
Right? 10 years ago, we were talking about vitamin supplements. And here we have, I mean, for an hour, we've been talking about different gene-based therapies, getting at the gene itself, the RNA, the protein product. We were not even in the same city, let alone the same ballpark, 10 years ago. So we have made so many leaps and bounds in the past decade. It is just remarkable to watch. I started doing HD-related research in 2002. It is a totally different world today. Totally different. It's really, I have to look at what's out there in terms of the data. I have to, of course, because it impacts a lot of people, I have to go with what's out there and safe. But it's also probably the most hopeful and optimistic time I've ever seen when it comes to Huntington's disease. So it's when I was telling people they had the gene, I'm sorry to tell you, you have a gene expansion for Huntington's disease 10, 15 years ago. I mean, we would then be talking about creatine and coenzyme Q10 and blueberry extract and trehalose. It was a shot in the dark. I tell people today, and if they're 25 years old, in 10 years, some of these therapies may be very real and may intervene and stop them from ever getting the disease in the first place. That's where we are in terms of this transition. It's a really hopeful time, and I'm very optimistic about it, and I hope one of these approaches really does work. But you can see it's going to be 5-10 years before these are ready and on the market.
Do you think these things will basically help anybody that has, is somewhere in the disease process, to say, we can not only prevent it from anybody getting it, but we can also say to you, based on where you are, we could actually back the clock.
Yeah, I mean, of course that's the hope, right? So if someone we're at the stage now that we can prevent it, and that's through PGD and amniocentesis and all kinds of other types of interventions, right? So we can prevent the people from inheriting the disease altogether through our reproductive technologies. But if we get to the stage where we can delay the disease onset, or we can slow the progression, and if we intervene earlier, then people may never get the disease. And I don't know what that means for people that have the disease already. If we stop the progression, are we able to then gain some of that function back? If I have a patient that has so much dystonia that they can't move or walk and they're unable to talk at this point, am I gonna be able to get that person to be able to walk and talk and function normally? I would say probably not. But if I have someone who just has a few symptoms, whether it's cognitive, behavioral, motor, can we get that to reverse? Can we get that to stabilize so that they stay functional in society? Obviously that's the hope, but I don't think that we really know the answer to that question until we get these on the market and start using it in a more widespread fashion.
And if I ask it again, we'll.
One more time we'll look fast, we'll get a little closer.
Cross fingers, keep hope.